Our Epidemiology Bureau has been monitoring the increase of influenza-like illness, yung parang trangkaso.
Now that it's getting colder and rainy, are you one of those who have experienced this? If yes, no wonder, because the number of those who've had flu-like illness are up 26% in the first 2 weeks of September compared to the last 2 weeks of August. Flu-like illnesses include fever, cough, and colds. The increase is even higher at 45% for the entire year compared to last year. Health Secretary Ted Herbosa reveals that because of this, some schools are switching to online learning for the meantime.
It's really the time during the rainy season where respiratory illness increases kasi nga sarado ang bintana, we're in enclosed spaces, and people can really get infected.
Herbosa says this has been the trend since 2009. The number is just higher this year as they intensified their surveillance systems. He's advising the public to take the flu vaccine, which is also free at the DOH. It's also better to stay home, he adds, if you're a senior citizen or has comorbidities, especially if your purpose of going out isn't really that urgent.
Things we learned during COVID, pa-practice lang natin. Wear a mask also. The other one is masking again if you have cough, colds, or respiratory illness.
The health chief explains the higher number of flu-like illness cases in the Philippines isn't related to Singapore's recent surge in COVID cases. The city-state is now experiencing an infection wave of the milder strain of the XBB Omicron variant. No reported deaths so far. Health authorities, however, are contemplating if they will be needing to buy Moderna's monovalent vaccines. These are for senior citizens, immunocompromised, or with comorbidities, especially if the new COVID variants make their way to the Philippines.
So we will have to study what the advice will be on in terms of this, and we're looking at what other countries are doing and what WHO will recommend.
Rex Remitio, CNN Philippines.